what is the precise indication for steroids in seborrheic thyroiditis? Is there really an indication?
Is there an indication for steroids?
I think it depends on your clinical assessment of the patient. I think, as I said just now, if the pain is very severe, you do have that up your sleeve to almost overnight alleviate the pain. But I have to say I don't often use steroids because in my experience anyway, the pain isn't that severe. But I think that's a clinical judgment based upon the severity of the pain. There's no, I'm afraid we haven't got guidelines on that because it's so uncommon.
It so happened that during last CAD conference, the organizer, Dr. Shailaja Kade, she happened to meet Dr. Kshitija Kulkarni. And Dr. Kshitija Kulkarni told her that while listening to your deliberations, we thought that we should also get some time for participating and presenting what type of work we are doing. And she is going to present to us her data of the patients which she had seen, and she has found out things. So I think it will be an interesting session because the epidemiological data that we collect many times is a big tool towards finding out new things and diagnosing many new conditions. So let us see what Dr. Kshitija Kulkarni has to present.
Thank you, sir. Honorable Chairpersons and respected doctors, good evening. After such an informative and guiding experience by Dr. Vas, I am standing here to share with you a short presentation on our experience of thyroid cases at Daun. Little about Daun. It is a taluka place with population around 3.5 lakhs. It is 80 kilometers to the east of Pune and has both urban and rural population. And it has also migratory population due to railway junction and industrial area. We all come across many thyroid disorders in our OPD and IPD. Hypothyroidism is a very common presentation in them. Though it is a simple to diagnose and easy to work up and treat disorder, it is a very important one because of its association with many other medical conditions which have significant clinical morbidity. And that is why we thought of going through our registry data of hospital. We have our own hospital set up with ICU beds at Daun, Maharashtra. In our study, we screened 10,000 OPD patients from November 2010. All the patients attending OPD were enrolled serially. Patients with comorbid conditions are also included in them. We adjusted the doses by 12.5 to 25 micrograms, monitoring the TSH 6 weekly initially, and once it is normalized, then we are doing it in every summer and winter season. Object of our study was to find prevalence of hypothyroid patients in general medicine OPD, to find association between hypothyroidism and other autoimmune diseases, endocrine or non-endocrine, and to study the usual dose requirement of thyroxine in the study population. Out of the 10,000 patients screened, we found out 292 patients to be hypothyroid. Out of them, 278 patients are of autoimmune thyroiditis. 9 patients had received radioiodine for Graves' disease. 4 patients had undergone thyroidectomy, and 1 patient was of postpartum thyroiditis. Out of these 292 patients, 134 patients were of overt hypothyroidism, and 155 patients were of subclinical hypothyroidism. According to the NHA-NES3 study, the percentage of overt and subclinical hypothyroidism is 0.3% and 4.3% in this data. The difference here could be because the population studied in this American study was general population as a whole, and we have screened the hospital patients in our data. Sex differentiation: out of these 292 cases, 238 were females and 54 were male patients, which goes with other worldwide data also. Now we'll see the association of hypothyroidism with other medical disorders. Firstly, with diabetes, we found 5 patients with type 1 diabetes mellitus in these 292 hypothyroid patients. The relationship between type 1 diabetes mellitus and autoimmune hypothyroidism has been already established as they have common genetic denominator, and 30% of the patients of type 1 diabetes have hypothyroidism. Regarding type 2, we got 61 patients with type 2 diabetes. Now whether type 2 diabetes mellitus also had genetic association with hypothyroidism is being studied. GAD65 autoantibody seems to be the common linkage in this case. But insulin resistance, metabolic alteration like increased lipids, vascular changes in hypothyroidism, they can also cause increased incidence of hypothyroidism in type 2 diabetes mellitus. Now, recently metformin, which is very commonly used in type 2 diabetes mellitus, is being explored for its use in TSH lowering effect. Now, regarding its association with hypertension, we found out 91 patients to be hypertensive out of these 292 patients. The prevalence of hypertension in hypothyroidism varies from 0 to 50%. In present data, it comes to be around 31.2%. So, just making the patient euthyroid is not the treatment of this case, but they also need antihypertensive treatment because the vessels lose their elasticity due to the deposition of glycosaminoglycans, and calcium channel blockers are the preferred drugs in such cases. Regarding asthma, we had some interesting finding. Out of these patients, we found 32 patients to be asthmatic who needed treatment regularly, and the prevalence of asthma in the study population was 3.1%. The clinical data from India suggests that the prevalence of asthma in our community to be around 2.8%. So this is the finding in our data. In the hypothyroid patient, the percentage was around 11%. So whether asthma also has got some linkage with hypothyroidism, and whether it is genetic or non-genetic, some environmental or local factor, we need to see into it. And yes. Achieving euthyroid state in asthma leads to improvement in the quality of life of such patients. These are the other cases associated with hypothyroidism like IHD, dyslipidemia, etc. Regarding the differential dose requirement, we have taken doses varying from 12.5 to 250 micrograms, and you can see from this chart more than 70% of the patients required doses less than 88 micrograms. And this suggests that thyroxine has narrow therapeutic index, and doses as little as 12.5 micrograms can have clinical consequences. Strengths varying from 12.5 to 200 micrograms are now available in Indian market to make our treatments easier. To conclude, prevalence of hypothyroidism in general medicine OPD is around 2.9% in our data. Association between hypothyroidism and asthma can have some linkage, genetic or non-genetic, which needs to be explored. I think we can put this as a question to our experts. And the usual dose requirement which we required was around 25, 50 and 75 micrograms. And this we did because initially during our study days, the usual doses which we were prescribing were around 100 and in divided doses like in times of 100.
Thank you, Dr. Kshitija.
Yes.
I think tomorrow we have a whole lecture by Professor John on when to treat subclinical hypothyroidism. Whether we are overdiagnosing our patients or over-treating them, we'll know that tomorrow. Any comments, Professor John?
Don't go away. All right, that's a very nice presentation. Thank you very much indeed. Just a few things. The incidence of post-radioactive iodine hypothyroidism.
Pardon, sorry, sir?
Sorry, the incidence of post-radioactive iodine is quite low, and your incidence of thyroxine treatment after thyroidectomy is quite low, which is very interesting. It's very interesting also that your doses are quite low, and I noticed that you're a lot slimmer than we are on the whole. So I think that may be one reason, but I'm not sure that it's the entire reason. And I just wondered whether there was any age distribution of your hypothyroid patients, because certainly the Wickham study to which you referred, which was the study done in Newcastle a little while back now, shows very distinctly that women are much more commonly affected over the age of 65. So I always say it's worth doing a TSH on a woman who comes in over the age of 65, more importantly than the electrolytes, which because of the TSH is more likely to be abnormal. Anyway, that was a very nice study. Just a few off-the-cuff comments after.
Excuse me, sir, regarding asthma, would you comment something?
Sorry?
Association with asthma, as we have seen the more
I haven't
incidence
heard of that before. That's very interesting, actually.
Okay. Thank you, sir.
Thank you.
Well, I think we have finished with this case. So I take this opportunity to thank Professor Was for his extensive guidance, and also I take this opportunity to thank the chairpersons and Dr. Girish Rajadev.
Confident lecture म्हटले
त्यांनी मध्येच मला डिस्टर्ब केलं नाही तर माझी 2-4 वाक्य मिस झाली त्यामुळे
I really appreciate that